You guys let me know when you're ready.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and thanks for being with us for today's press briefing on this, it is the 14th, correct? January 14th, 2021. We appreciate you being here. Thanks to all the members of the media joining us on the webinar. We always appreciate your questions when we're able to do this. And for those of you joining us by YouTube or Facebook, we appreciate you being with us as well. My name is Fields Mosley. I'm the Communications Director for Maricopa County. I'm also the lead PIO for the Joint Information Center, where we try to answer questions from the public, but mostly questions from the media every day. So again, we appreciate you being here. Today we're going to be talking about vaccination progress, plans moving forward, and try to answer any questions you might have as we continue that prioritization group in Phase 1B, as well as finishing up Phase 1A. Today I have Dr. Rebecca Sonnenschein. She's the Medical Director for the Maricopa County Department of Public Health. She is with us today. Also, the Director of Emergency Management here in Maricopa County, Robert Rowley, is here if you have questions about PPE and what kind of PPE we have distributed. Also with us today we have Joanna Molina, a PIO with Public Health. She will be interpreting into Spanish the question and answer portion for those members of the media or the public that primarily speak Spanish, and that's easier for them to understand. So a few quick housekeeping notes. As always, if you're the way we run this, once we get to the Q&A portion, if you have a question, please virtually raise your hand in the GoToWebinar, and Ron will call on you to ask your question. You need to make sure you are unmuted, whether you're on your phone or your laptop, whatever microphone you're using, make sure you're unmuted. If you're struggling to get the program to let you virtually raise your hand or anything like that, we sometimes find you need to log out and log back in to GoToWebinar to make that work. So we have a lot to discuss today. A lot has happened in the last week, and so I'll invite up Dr. Rebecca Sonnenschein to get us started.
Thank you, Fields, and good afternoon. We know that vaccines represent hope for an end to this pandemic and return for a life as normal. We also know that there has been a lot of attention placed around the point of dispensing sites, or pods as we call them, that are going on throughout the county. Pods allow us to vaccinate as many people as possible in a quick, safe, and efficient manner. And we're vaccinating about 10,000 people per day at our Maricopa County pods. Additional efforts are also underway to bring vaccine into the community when it becomes available. We're working around the clock to put more partnerships and locations in place so that we can have additional pods when more vaccine arrives. Multiple pharmacy locations have already been set up. We currently have 8 in place at this moment, and we are constantly adding more pharmacy locations to serve our older adults who are 75 and over and who are the most vulnerable to severe disease. We will continue to add these pharmacy locations as we can. This partnership adds to existing federal efforts to use pharmacies to provide on-site clinics to vaccinate residents and staff at long-term care facilities who are still being prioritized to receive COVID-19 vaccine. It's also critically important that school and child care teachers and staff are protected and able to care for and educate our community's children. We're working with associations and school districts to develop vaccination events specifically for the estimated 100,000 school and child care workers in Maricopa County. These events will be offered at locations across the county so that they are convenient, easy to access, and on days and times that work around their schedules. These sites will serve staff at public schools, private schools, charter schools, and all the charter schools in the area so that no one is left out of the process. Some of these school and child care pods will begin as early as next week, and we are working with districts and school associations to communicate this with all school staff so they are aware of when their school and child care pod will be scheduled. The same applies for law enforcement. We're working with municipalities to create events specifically for law enforcement in their area. All of this is about Phase 1B, and we are also continuing to provide first and second doses for those who are in Phase 1A, including healthcare workers and residents and staff of long-term care facilities. Vaccinations for long-term care facilities are ongoing. With so many small facilities, it takes a lot of coordination and time to get into each facility and ensure that everybody is offered a vaccination, both the residents and the staff. We're working every day to get more of them vaccinated, while the CDC Federal Pharmacy Partnership is also working in parallel to get those long-term care facility residents and staff vaccinated. We know that many people were eager for Phase 1B prioritized to begin this week, and they're still trying to get appointments. As we've said before, the number of appointments and locations are limited by how much vaccine is available. As more vaccine becomes available, more appointments will open up, and we will be able to get more folks in Phases 1A and 1B in for both their first and their second doses. Much like when you get other health care, whether it's from a clinic or from your primary care provider, each vaccine provider has its own registration process. So for people who need assistance making an appointment using the ADHS online registration system, you can call 211 and be connected to a navigator. Thank you.
Thank you so much, Dr. Sonnenschein, for that brief update. We will now go to our question and answer period from members of the media who have joined us on the webinar. Ron, do we have anybody standing by?
Yes, good afternoon. Ann Ryman is up next. Ann, your mic is unmuted.
Hi, thank you for doing this. I wondered, what's the status of the vaccinations for the assisted living facilities? How many facilities are we talking about here? And if somebody has not heard back from the county and they're not through CVS or Walgreens, who can they contact for information about the status of when they may get their visit?
Okay, Ann, thank you so much for the question. I know at my last check, we had more than 1,000 facilities, assisted living facilities on our list at Public Health. And I also know there is a link on there where they were able to go and register themselves for that. So, Dr. Sonnenschein, do you have anything else to add to that? That's really, so if they want to go, they can search up long-term care facilities or assisted living facilities on maricopa.gov/public health, which is, or the COVID-19 page. You can get there from there as well. But that's a very important group. And of course, we are, as Dr. Sonnenschein was saying, we're running those parallel tracks with that CDC program that started at the national level. So any of those group homes or assisted living facilities that didn't sign up through that national program, they can sign up through Public Health, through that registration form that's on our website. Joanna, would you like to come up and translate that?
La pregunta es, ¿cuál es el estatus de vacunación para las personas que viven en centros de cuidado de largo plazo? ¿Y a quién debe de llamar o comunicarse si aún no los han vacunado? Bueno, sabemos que al momento más de 1,000 de esos centros de cuidado de largo plazo están esperando que ser vacunados en cuestión de que han llenado una solicitud con Salud Pública del Condado Maricopa. Pero esto es solamente parte del programa porque muchos de estos centros están colaborando con farmacias a nivel federal con CDC para que sus residentes y personal sea vacunado a través de ese programa nacional. Si quieren tener más información, visiten nuestra página donde van a encontrar un enlace y llenar una forma para poder solicitar vacunación. El maricopa.gov/vacuna COVID-19.
And thank you so much for the question. Ron, do we have somebody else standing by?
Yes, Fields. Katie Davis-Young is up next. Katie, your mic is unmuted.
Hi there. I've got a kind of multiple part question. I understand that the Maricopa County website crashed on Monday when the 1B group opened up because there was too much demand. I think that's expanding again next week for the 65 and older part of 1B. So have the glitches been resolved, and are you doing anything to prepare for that kind of next expansion? And then my next question was also about booking appointments. I've just had some questions from listeners about trying to figure out how to get their second dose booked and going and seeing that appointments are all booked up. So is there a different process for booking your second appointment?
Okay, so there's a lot there to unwrap, but I'll just tell you right now, Katie, we've been answering these questions through the Joint Information Center all week, as well as Public Health, dealing with an overwhelming demand and demand for information through the call center, as well as emails and everything else. So let me start first with the website, since I know quite a bit about that. We did reach out and we made sure we had a lot of resources in place for bandwidth and everything else going into Monday's launch. So we had 500,000 people hit the website at 6 a.m. approximately. So 500,000 people on the website is about 50% of what we receive every single month on maricopa.gov. So fair to say we expected tens of thousands. We did not expect hundreds of thousands on maricopa.gov. So that's what caused that initial issue with people going there. So let me go to the next step there. So yes, we have reached out to our service provider, our content management system, to work with them and make sure we have plenty of resources for any other moments that we might get that kind of traffic once again. And we feel like we are prepared for that. That said, and Dr. Sonnenschein can expand on the 65 plus question, but I think that moving forward, and we'll have those resources in place for maricopa.gov. And also, I've described our website this way. We have a lot of information there for people to get educated about COVID-19, when they can get the vaccine, perhaps places they can get the vaccine, and they get links to appointment systems. Maricopa County does not run the appointment systems for whether it be the hospital systems for phase 1A or the ADHS system that most people are dealing with right now. So we don't run those appointment systems, or for our pharmacies. Our pharmacy partners, they have their own systems as well. So to that appointment question, that's a little bit different question that has other entities involved. The biggest one, of course, being the state with ADHS having their appointment system, and you would have to ask them about those second appointments and how those are working out right now. We do know that the phase 1A folks, the frontline healthcare workers, they were scheduled their second appointment, most of them anyway. Some of them are still trying to get them because we've now opened up these appointments. But I'll let Dr. Sonnenschein come up and expand a little bit on what I said, and I hope I knocked off the website questions at least.
Thank you, Fields, and thank you for that question. So we are aware that some people are still having trouble getting those second dose appointments. And for individuals who are experiencing trouble, they can call 211 to help assist them in getting appointments. Right now, we're limited by how many vaccine doses we have available and how many appointments are available. We anticipate that more vaccine will become available over the next few weeks, and we're working on opening up more locations and more appointments so that we can get those doses out when we get larger allocations. We know that ADHS has announced that they are opening up to those who are 65 and over. However, Maricopa County is dedicated to its current mission of serving those in phases 1A and prioritized 1B, which does include those school and child care workers, law enforcement, and those who are 75 and older. So until we can get further along in that mission, we are not going to be able to open up and expand to other groups until that vaccine opens up in supply. So right now, we are working on getting everyone in those groups vaccinated, and we're not sure when we'll have enough vaccine to include the additional 400,000 people in the 65 and over category, which will take 800,000 additional doses. But when we get to that point, we're going to be ready with additional pods planned so we can get that vaccine out to everyone who wants it. Thank you.
Bueno, son varias preguntas y vamos a tratar de contestarlas todas. Okay, el sitio del condado Maricopa, el lunes que inició el registro para la fase 1B, se inundó con visitantes a esta página. Y cómo nos hemos preparado para las siguientes fases si es que llegara a suceder otra vez que el sistema no esté funcionando. Y cuál es si es un proceso diferente ahora. Bueno, tenemos varios recursos que hemos añadido a partir del lunes, porque cabe mencionar que este lunes 500,000 de personas visitaron nuestra página a las 6 de la mañana. Eso es el 50% de todas las visitas que recibimos en un mes. Ahora el sistema de manejo de páginas de Internet ha sido notificado y está trabajando con nosotros por si llegara a suceder algo similar, estar listos y poder tener eso en cuenta. En cuestión de las citas, las citas no se hacen a través del Departamento de Salud del Condado, sino a través del Departamento de Salud del Estado. Y para hacer las segundas citas tendrán que hacer ese mismo proceso, visitar la página del Departamento de Servicios de Salud del Estado. Algunas personas no se han podido todavía vacunar para recibir la segunda dosis y ellos pueden llamar al 211 para tener asistencia de un navegador. Tenemos limitadas las vacunas al momento porque no tenemos la vacuna suficiente. Entonces, en cuanto lleguen más recursos de vacunas, se podrán expandir esos sitios de vacunación. El Estado va a abrir para las personas de 65 años a partir de la semana que entra y en el condado todavía seguiremos con la fase 1A y 1B, que incluye a las personas de 75 años, también personal de la educación y también agentes del orden. Y hasta que no tengamos más vacuna en el condado, no podremos agregar a más personas, incluyendo las de 65 años. Estamos hablando de más de 400,000 personas de esa edad y no tenemos esas dosis de vacunas al momento.
Thank you so much, Katie, for the questions. A lot to unpack there, and it all kind of wraps around together everything we're trying to accomplish this week and beyond. So, Ron, do we have somebody else on standby?
Yes, Fields. Erasmus Baxter is up next.
Okay.
Erasmus, your microphone is unmuted.
Hi, can you hear me all right?
We certainly can. Go ahead.
Great. I just had one follow-up on what Dr. Sonnenschein said and then one question. So following up on what Dr. Sonnenschein just said, does that mean that the state-run site will be operating with different criteria than the county pods? And then question for Dr. Sonnenschein, could you clarify what the county is telling the higher ed institutions regarding eligibility? I've heard there's some conflicting information out there between what the community colleges and ASU are hearing.
So, Rasmus, I guess the simplest way to answer that is while it seems that we're doing different things. Yes, we are. When it comes to 65 plus, we certainly have a lot of people in that group. That's a group of about 400,000 in our county alone. So this is a very important group, and we're going to get to them as quickly as we possibly can. But we certainly have to have the capacity to do that. So meanwhile, the state that system, that scheduling appointment at their pods or their pod, and then a future pod they announced this week, that they will be handling that for those pods as well, and that will include that group, is what they have indicated publicly. So whenever it comes to various groups and various colleges, obviously we have a lot of universities and education groups in this county. And we know that ASU has been working with ADHS and the governor's office to allow vaccinations for some of their staff, at least. And that is something they've talked with the state about. Meanwhile, we've had communications with various education groups. But Dr. Sonnenschein referred to our mission. And our mission right now, as stated on our website, is K through 12 educators. And this is a very important group as well. And as the same criteria applies that Dr. Sonnenschein just mentioned. We will work our way through that group. We have a lot more people to vaccinate in that group, and we're setting up separate events for education folks that fit that criteria of K through 12. So once we're complete with that mission, complete with that group, we'll move on to broader education communities. And I hope that answers your question. I'll have Joanna come up and translate that.
Okay. Son dos preguntas y la primera es, ¿el Estado tiene diferentes criterios de vacunación entonces a lo que tiene el condado? ¿Y qué se le está diciendo a las escuelas de educación superior si todavía no se pueden vacunar o se pueden vacunar? Bueno, en este momento vamos a recalcar que el Estado es el que está dirigiendo la forma de registro. Entonces, algunas escuelas superiores están colaborando directamente con el Departamento de Salud del Estado para vacunar a su personal. Otras escuelas y universidades también están trabajando con ellos para tener el mismo proceso de vacunación. Nosotros en el condado nos estamos enfocando en lo que viene siendo del kinder al grado 12, todo el personal de escuelas en ese nivel para poderlos vacunar. Y estamos hablando que serán eventos especiales o clínicas especiales separados precisamente para no utilizar otros recursos y que todo ese personal de escuelas se pueda vacunar.
Rasmus, thanks so much for the questions. Ron, do we have somebody else standing by?
Yes, Fields. Matt Roy has a question. He's having some technical difficulties, so he asked me to ask the question for him.
Okay.
He says, what is the county doing in terms of outreach and messaging to encourage vaccination, particularly among those who may be skeptical about the need for or efficacy of the vaccine?
So safety and efficacy is the question, and how we're communicating that to folks?
That's correct.
Okay. Dr. Sonnenschein would like to address that, but I can say that we have a plethora of information on our website right now on the public health pages, and they've spent a great deal of time putting it into FAQs and easy to read formats to talk about vaccine. But Dr. Sonnenschein is the expert in vaccines, and she can certainly speak more to that.
Thank you. We understand that it's important that everyone have access to accurate information about the vaccine. We've been working closely with a lot of different partners to reach our traditional groups and also those individuals who may have a more difficult time accessing information. We're working with the Valley Interfaith Partnership to get through to our communities of faith. We're working through our refugee communities to make sure that they have accurate information available in all different languages. We're also working with the Arizona Partnership for Immunization to have large talks available geared toward different audiences to make sure people are aware of accurate information on the vaccine. And we've gone through great efforts to make sure that our website is continually updated, as well as having different talks scheduled for the school communities, for municipalities, and other partners. Thank you.
La pregunta es, ¿qué se está haciendo en el condado para educar sobre la seguridad y la eficacia de la vacuna COVID-19? Bueno, les vamos a recomendar que visiten nuestra página en español, donde va a encontrar las preguntas frecuentes, incluyendo este tipo de preguntas en maricopa.gov/vacuna COVID-19. Pero también cabe mencionar que estamos trabajando muy de cerca con socios que trabajan con grupos que son quizás difíciles de alcanzar, ya sea por el idioma, por nivel de educación o por diferentes razones. Hablamos de grupos de refugiados, también de grupos de fe, organizaciones que trabajan con las personas de vacunación, como lo viene siendo TAPI, al igual que también tenemos el tipo de relación con las municipalidades y muchos otros grupos.
Thank you, Matt, for the question. And before we move on, I have to put a plug in for the team at the Joint Information Center. We are putting out a newsletter Monday through Friday, almost every single week since, or on that schedule almost every single week since this all began. That newsletter now reaching more than 40,000, 50,000, almost 50,000 emails a day as well, and it's been shared widely. We've noticed a definite uptick as we've hit phase 1B. So if people are interested in getting information, a lot of times it includes information or links to information about the efficacy and the safety of the vaccines, as well as all the other information we're providing. We encourage members of the public and members of the media to subscribe to that and make sure they get that. But we do send it to our media list every day. And I'd also mention the Maricopa, the public health pages that deal with COVID-19 are in Spanish as well as English. So I think it's very important to know. Ron, who do we have next?
This field, Matt Galka is up next. Matt, your mic is unmuted.
Matt, we can't hear you.
How about now? Can you hear me now?
We certainly can. Go ahead.
All right, great. So I have two questions. My first one might be a little easier than the second one. So I'll start with the first one. GCU announced that they're going to be a dispensing site, and they were hoping to be up and running by next week. Do they have vaccine supply? Are you guys working with them? Are they doing their own thing, or are they going to have to wait till February also?
Okay, yeah, we're happy to talk about that partnership we have with GCU and the vaccine that we gave them in order to open this pot. So Dr. Sonnenschein will come up and talk a little more about that.
Thank you for that question. We have been working closely with Grand Canyon University in all of their planning for their pod. We're excited that they are almost ready to begin vaccinating, and now with the increased need for both first and second doses, we are excited that they will be beginning to offer at least 500 appointments per day, and they hope to expand in the future. We have been working closely with ADHS to make sure that, again, that there is enough of vaccine available to supply all of the Maricopa County pods, including GCU, moving forward. Thank you.
La pregunta es que GCU, la Universidad del Gran Cañón, anunció que será un sitio de vacunación y que empezará a operar la semana que entra. ¿Acaso estamos colaborando con ellos o ellos están haciendo su propio evento? Bueno, sí estamos trabajando muy de cerca con Grand Canyon University o la Universidad del Gran Cañón, especialmente por la clara necesidad que existe de poner la primera y segunda dosis en la fase 1A y 1B. Estamos trabajando para que tengan 500 citas por día y también trabajamos muy de cerca con el Departamento de Servicios de Salud del Estado para asegurarnos que tengamos suficiente vacuna para estos sitios.
Thank you for the question, Matt. Ron, do we have somebody else?
Yes, Fields. Nicole Krug is up next. Nicole, your mic is unmuted.
Go ahead, Nicole.
Hello, thank you. I have two questions. The first part is about the vaccines and how it appears the focus is vaccines. But with uncontrolled spread, we're having over 700 deaths a week in Arizona. I was just wondering if Dr. Sonnenschein is communicating with the state, advising to do more, and what's the response? And then also about expanding your morgue capacity with the new project that you guys just finished in December. Do you have any indication that you're going to exceed your new space that you have with having over 700 deaths a week in December for multiple weeks?
Okay, two-part question. Well, multiple questions there. So we will start with Dr. Sonnenschein answering your questions about mitigation efforts and what is going on, and then I'll have Director Rowley come up and talk about the fatality management plan. And we'll have Joanna translate in between.
Thank you, Nicole. Unfortunately, local public health departments have little authority to put any prevention or mitigation measures in place for COVID-19. We continue to ask everyone to do their part, to wear a mask, to wash your hands, to avoid touching your face, avoiding groups of people, and trying to avoid spending time with those who are outside of their households. However, it's important that we focus on what we can control, which is trying to get as much vaccine out as we possibly can. Thank you.
Okay. Son varias preguntas, vamos a contestarlas. El enfoque de la vacunación es lo que se ha escuchado últimamente, pero ¿qué pasa con las 700 muertes por día que están sucediendo en Arizona? ¿Y qué se está haciendo? ¿Acaso se están comunicando con el Estado? ¿Se le está dando algún tipo de recomendación? ¿Y qué capacidad hay para las morgues? En este caso, la segunda pregunta. Vamos a contestar la primera. Desafortunadamente, tenemos muy poca autoridad, lo que viene siendo los departamentos de salud locales o a nivel condado, para poner algún tipo de restricción. Pero sí nos podemos enfocar en las cosas que sí tenemos control. En este caso, tener las formas de mitigación como el uso de la mascarilla, quedarnos en casa si estamos enfermos, lavarnos las manos constantemente, y ahora que hay una vacuna, también poner énfasis el que tiene la oportunidad de vacunarse, que lo haga en estos momentos.
Good afternoon. Just to refresh, the question I believe was, are we concerned about the current fatality surge that we are seeing, and what it is we are doing about that to be prepared? As you may recall, we had a fatality surge back in July, and we had started planning for that eventuality or that possibility in June and earlier, which is why we put in the temporary morgue site to allow for expansion of storage for the Office of Medical Examiner. That resource is still on site, just not used at this moment. And in the meantime, the Office of Medical Examiner expanded their internal surge capacity to up to 350. So just for some perspective, if they had had that capacity back in July, we wouldn't have needed the temporary morgue site at all. So we are now prepared for a surge similar to what we saw in July and beyond that with the resources we have in place. We are also prepared to expand beyond our current surge capability through planning with the State Department of Emergency and Military Affairs and coordination with the State Funeral Board and our Fatality Management Unit with the Unified Command. So we believe we're in a good position to deal with a surge similar to what we saw in July and to go beyond that if necessary. And we have plans in place to surge further than our current capability if we see a situation worse than July. Thank you.
La pregunta segunda fue ¿cuál es la capacidad que se tiene en la morgue? Estamos viendo que hay mucha gente que está pereciendo. Bueno, la respuesta es que desde julio pasado, cuando empezamos a ver que había necesidad de expandir el acceso a las morgues o a lo que viene siendo el espacio para poder guardar cuerpos, se puso en marcha un plan y todavía está vigente. Se tiene capacidad para ofrecer asistencia al médico forense en caso de que se necesitara en el condado Maricopa. Ellos ahora han expandido también su capacidad para poder almacenar cuerpos hasta 350. También nosotros tenemos la capacidad para expandir si fuera necesario, trabajando con el Departamento de Salud del Estado, con la Junta de Funerarias y también con los asuntos militares.
Thank you so much, Nicole, for the questions. Hope we got you some answers there that help you out. Ron, do we have somebody else standing by?
Yes, Fields. Peter Seymour is up next. Peter, your mic is unmuted.
Hello, good afternoon. So a couple of related questions. So I know there's a vaccine shortage in Maricopa County, hence the age cutoff is still 75. What's a timeline that you have for vaccines reaching pharmacies and pods from the providers? I'm guessing Pfizer and Moderna are trying to make even more. What's the timeline? When do you think the county will be able to receive more vaccines?
Very good question, Peter. So Dr. Sonnenschein will come up and answer that as best she can.
Thank you for that question. I think it's an important question and one that we're all anxiously awaiting when more vaccine will become available. We have heard that the federal government may release additional doses. So that is why we are working with all of our partners to make sure that we have additional pod locations that could get more vaccine out if it becomes available. And we are working with all of our pharmacy partners. And I want to make sure folks know that we already have a lot of pharmacies that are offering vaccine. There's a separate pharmacy program that is working with our federal partners where they will be able to get vaccine out to an additional pharmacy locations. And that's in addition to the pharmacies working with long-term care facilities. So there's a lot in the works for pharmacies, but the one thing we don't know is when those increased allocations will come. So we are preparing and getting ready so that when they arrive, we can get them out as quickly as we can.
La pregunta es que si existe poca vacuna y se están agregando más grupos, ¿no? ¿Cuál es el tiempo para recibir más vacunas y por qué no se da a sitios más como las farmacias y las oficinas de los doctores? Bueno, sabemos que no tenemos la suficiente vacuna en el momento y estamos listos para recibirla cuando las tengamos que llegue a nuestro condado. Sin embargo, también sabemos que el gobierno federal estará enviándola, es la información que se nos ha dado, no sabemos cuándo, no tenemos una fecha, pero estamos listos y estamos preparados, trabajando con socios y con listos para poner otros sitios de distribución. Cabe mencionar que las farmacias también están colaborando, además con los centros de cuidado a largo plazo, también de otra forma para poder asistir en ese proceso de vacunación.
Thank you, Peter, for the questions. Ron, do we have somebody else waiting?
Yes, Fields. Cameron Pullen is up next. Cameron, your mic is unmuted.
Thanks, guys. Most of my questions have been answered, but I do want to ask these two questions. 75 and older who can't drive themselves, how are we getting vaccine to those who might not have the same ability to get from two locations right now as we're moving into that group? I've heard from folks who are, don't have real, loved ones to bring them. They're in their 80s and they don't drive anymore. Two, locations for teachers. I'm assuming there will be multiple pods for teachers because there are so many school districts all over Maricopa County. Will we have an East Valley and a West Valley? How many pods will be dedicated to getting those districts vaccinated?
Yeah, a lot of good questions there. Homebound seniors and how are we going to get the vaccine to them, as well as locations or numbers at least for school pods and how we're going to distribute that to those educators that have been waiting so patiently up till now. Dr. Sonnenschein can take those questions.
Thank you for asking about that population of homebound seniors. We recognize that pods aren't going to be able to serve everyone, so we're working closely with our home health care associations to supply vaccines so that they can work with us to get to those homebound individuals and get them vaccinated. And that partnership is in process right now and plans are being developed. As to the question, will there be multiple pods? I can say confidently that all of the Maricopa County public school districts have been divided into 17 groupings, and those are grouping schools together, districts together that normally work together in geographic areas and making sure that the charter and the private schools are also included in those groupings as well as childcare. So each of those 17 groups are being paired with a pharmacy partner to arrange as many pod appointments and locations as they need to meet the needs of their population. So some of these groups might be smaller and may be able to have one pod location on one day for the first dose and for the second, and others may need to have 4 different locations just to serve that grouping. Those are all being set up now. The point of contacts have all been established, and they're currently being partnered with their pharmacy partners so that they can arrange those times and dates. Thank you.
Y la pregunta es que las personas de 75 años o mayores que no pueden manejar, ¿cómo se vacunarán? Ellos no tienen transportación. Y también cuántas localidades hay para las escuelas, para poder vacunar a maestros. Si son tantas escuelas, ¿cómo se logrará? Bueno, cabe mencionar que estamos trabajando con la Asociación para Personas de 75 años o mayores, la Asociación de Personas de Cuidado que brindan cuidado en casa, para que ellos puedan vacunar a los que no pueden salir de su hogar. En cuestión de las escuelas, tenemos 17 grupos que van a estar trabajando con las escuelas y distritos escolares que se van a poner por grupos, en 17 grupos precisamente. Estas son escuelas públicas, escuelas privadas y escuelas charter. Estamos hablando de que ellos van a tener sus propios sitios de vacunación con las farmacias en estos centros de vacunación, que puede ser en un grupo que nada más se requiera un sitio de distribución, o puede ser un grupo que pueda requerir hasta 4 ubicaciones para poder vacunar a tanto personal.
Cameron, thank you so much for the questions. Ron, do we have somebody else standing by?
Yes, Fields. Matt Galka had a follow-up question. Matt, you're up.
Okay.
Hey, sorry about that. Can you hear me?
Sure, Matt.
All right. So I want to go back to something you said earlier. You rattled off the different websites, the state website, the Maricopa County website, the hospital website, registrations themselves. And I'll preface this by saying I don't think any rational person thinks that we can get this 100% right out of the gate. But with your website crashing, with multiple people over 75 years of age who are not tech savvy contacting me personally, asking to get them help to try and get them signed up, I'm wondering if obviously we can't do it now, but do you think a more centralized rollout would have avoided some of these problems that we're seeing this week? You say this coming from, I've been contacted by a lot of older people who just can't seem to get it right if they don't have family members, like Cameron was alluding to, here in town. So I'm wondering if you think a more centralized rollout would have been more effective right now.
I can't say whether a more centralized rollout would have been more effective on this. The appointment system is centralized for this particular group, and you'd have to ask ADHS how that particular piece of software is functioning. We do know that they have contracted with 211. They've also have their own phone bank set up, and we've provided the help that we can through the public health phone bank as well by bringing on more volunteers to try to help folks. I did mention some numbers, and I'm sorry if I didn't mean to rattle off a bunch of websites at the very beginning. I was mainly talking about our website because I'm very familiar with the resources that are on that website. And I haven't logged into the ADHS website. I have gone to the page that is linked from our website, and that is where people need to go. I do know that ADHS created a very detailed PowerPoint to try to help guide folks through that, because it is somewhat complicated to get through, and we recognize that. And that's why these phone banks are set up. But I also talked about volume. 500,000 people hitting our website, whether they were family members helping out their elderly relatives or their parents, or whether they were it was folks that were just trying to get the information themselves. I mean, that's a tremendous number of people. We know that there are almost 300,000 people in the 75 plus age group in Maricopa County alone. And I mentioned earlier, there are 400,000 or more in 65 to 74. So now we're talking about 650 to 700,000 people. So this is a tremendous number of people. And whether it was centralized or not, I don't have a napkin in front of me to do the math, but I think you would have to have a phone bank that would fill a warehouse in order to take all those calls. So it is going to take time. It is going to take a lot of time for the appointments to work out, even with these megapods that are being set up by ADHS. And of course, our pods filling in all those appointments all the way through January already. And as we've already talked about multiple times, this whole function is limited by the amount of vaccine that we get shipped into the state. So, Matt, I hope that answers your question. You're welcome to email us as well at the Joint Information Center. If you have any more detailed questions, we'll certainly try to answer those. And Joanna can come up and translate that.
Bueno, la pregunta es que si el sitio se inunda con personas que están visitándonos por el alto volumen de personas, y también las personas de 75 años no pueden hacer una cita por ellos mismos, entonces, ¿por qué no tener un punto central para hacer citas? ¿No sería mejor acaso hacer eso? Bueno, el Departamento de Salud del Estado es el que ha creado este sistema. También ellos crearon una presentación para guiar a las personas paso a paso lo que deben de hacer. También se ha creado lo que viene siendo los enlaces en las páginas de internet para poder hacer esas citas. Sabemos que miles de personas están visitando las páginas, lo que hace que se inunde la gente, a veces no encuentra lo que está buscando, pero vamos a dar algunos números. Cerca de 300,000 personas son las de 75 años solamente, y si añadimos a los que van a empezar de 65 a 74, estamos hablando de otros 400,000 personas. Entonces, cuando se añade toda esta cantidad de personas, en cualquier sitio va a haber algún tipo de que algo no esté funcionando. Entonces, va a tomar tiempo para poder vacunar a todo el mundo, específicamente cuando se tiene lo que viene siendo los megapuntos de distribución que tenemos en el momento.
Thank you, Matt, for the follow-up question. We'll take one, maybe two more questions. Ron, do we have anybody else waiting?
Ms. Fields, Matt Roy had a follow-up question. He's still having some technical difficulties. That question was, if there's time, is there any estimate, even roughly, about what the current percentage of Arizona or Maricopa County residents are that are vaccinated?
The percentage of residents that have been vaccinated. I know that's being tracked. That number is being tracked on the ADHS website. I know in our county, I just looked at it before I got here, and of course, there's a little bit of a delay by the time that gets entered at a pod and that data gets up to ADHS. So I know we crossed 100,000 just at the pods, the 5 pods that we've had open alone, and as well as, and I'm not sure if that includes second doses. I think that's people. And then I know we're well over 110,000 in Maricopa County. I don't know what the state rate is, but you can figure out the percentage of that. Would you like to expand on that, Dr. Sonnenschein? Yeah, Dr. Sonnenschein has a little more to say on that.
So that's a question that we're all very interested in finding out and tracking. And because we have county pods that are delivering vaccines as well as state pods delivering vaccines to Maricopa County residents, all of that data is coming together in a statewide system that tracks our immunization doses called ACIS. That data is being loaded into Maricopa County so that we can analyze it and determine not only what proportion are being vaccinated, but also looking at the race and ethnicity data and the age data so we can see what groups are we being able to successfully reach and which ones are we not able to reach. Unfortunately, the data coming in from ACIS is somewhat delayed, so we don't have an accurate figure right now. However, we are not only tracking that, but we are developing a tracking system and a dashboard that we hope to be able to share in the future that will tell people exactly the answer to your question. Thank you.
La pregunta es, ¿cuál es el porcentaje de personas en Arizona que se han vacunado hasta el momento? Bueno, nosotros podemos hablar por lo que es el condado Maricopa. A nivel estatal se canaliza a través del Departamento de Servicios de Salud del Estado. Pero sabemos que en lo que viene siendo nuestros 5 puntos de distribución que son operados por lo que viene siendo el condado Maricopa, son más de 100,000 personas las que ya se han vacunado hasta el momento. Este número cambia constantemente y este número fue hasta esta mañana. El condado y el estado tienen un sistema que pueden poner el número de personas, cuántas se han vacunado, incluyendo lo que viene siendo la raza o grupos técnicos y otro tipo de detalles en un sistema llamado ACES. Este sistema, obviamente, porque se está ahorita poniendo la información, todavía no tiene unos datos al momento que son vigentes. También Salud Pública del Condado Maricopa está trabajando para tener un tablero en nuestra página próximamente que pueda dar esos detalles.
As always, Dr. Sonnenschein says it way better than I do. So thank you, Matt, for that question. I'm sorry you're having technical difficulties with your microphone. This will be our last question, as everyone has other appointments at 2 p.m. this afternoon. So let's go ahead if anybody's on the line. Ron?
Feels there are no more questions at this time.
Well, look at that. I should have asked that first, apparently. So, all right. Thank you so much. Thanks to the team here. Thank you, everybody, the reporters out there working hard, trying to tell the story and get people accurate information. We appreciate you joining us today on the webinar and asking good questions. For those of you joining us by Facebook or YouTube, we appreciate you being here and getting information and sharing that information as we try to make sure everyone stays informed. This is going to be a long process, but we're working as diligently as we can with our partners to make this happen quickly. So thanks again, and we'll see you next time.